Hello and welcome to Pregnancy Info. Today we will discuss about 21 signs of labor. You should understand what is labor. Labor is the process of childbirth, starting with contractions of the uterus and ending with the delivery of the baby. If you are like a lot of pregnant women, you are probably wondering how you will know for sure that you are in labor. Look at the 21 signs of labor that tell you baby is on the way. Number 1. Baby drop. If you are first-time mom, your belly will typically start to drop or descend into your pelvis a few weeks before labor begins, usually around 2 to 4 weeks before, but it can vary. Cervix dilates. Your cervix too is starting to prepare for birth. It starts to dilate or open, and EFAs mean getting thin in the days or week before you deliver. At your weekly checkups in the home's stretch of your pregnancy, your provider may measure and track dilation and do it via an internal exam. Cramps. You feel more cramps and increased back pain, especially if this is not your first pregnancy. You may feel some crampiness. Your muscles and joints are stretching and shifting in the preparation for labor. More back pain. Due to more weight and due to stretch in your abdominal region, your back becomes stretched and get more hurted at this time. So it is also the sign of labor. Diarrhea. Due to certain hormones, you will face diarrhea. Just as the muscles in your uterus are relaxing in preparation for birth, so too are other muscles in your body, including those in the rectum, and that can lead to diarrhea. That pesky labor symptom you may have experienced at other time during pregnancy. You should stop gaining weight or lose some pounds. Weight gain often levels off at the very end of pregnancy. Some moms to be even lose a couple of pounds. This is normal and won't affect your baby's birth weight. He's still gaining, but you are dropping due to lower levels of amniotic fluid, more bathroom breaks, and maybe even increased activity. Change in discharge color. You may feel that the color of discharge may be mixed with the blood strain, so you may feel this change, and it is also the part of labor, or it can also be the sign of labor. Fatigue. You may feel extra tired. Wait a minute. In this, the third trimester or the first between the active bladder and the exhaustion, sometimes you can feel like you have traveled back times in time. That supersized belly along with your compressed bladder and other organs can make it tricky to get a good night's sleep during the last days of weeks of pregnancy. So pile up those pillows and take naps when you can, if it is possible. Strong contraction. You feel stronger, more frequent contractions. It is also the early sign of active labor. Expect when they aren't, you are experiencing Braxton Hicks contractions or practice contractions for weeks and even months before delivery. You'll feel their pinch as the muscles in your uterus tighten in preparation for their big moments, pushing that baby out. Water leak. Wild moves. Would you think you'll learn you are in labor only when your water breaks in the middle of a romantic dinner date at a busy restaurant? Of course, that's a very unlikely scenario. Your water breaking is actually one of the final signs of labor most women experience, and it happens in only around 15% of births or fewer, so don't count on it as a telltale surefire sign of labor. Mucus plug comes out, or you may say bloody show. You might notice a thick pinkish or blood streak discharge called a bloody show. This is the mucus plug that seals your cervix during pregnancy. It often appears several days before labor begins, although it is not always noticeable. Sensation of building pressure or cramping in your pelvic area or rectal area is also a common symptom or sign of labor. Braxton Hicks contractions or practice contractions that feel like a tightening or hardening of the uterus with possible mild cramps. It is also the sign of labor. Loose joints. Throughout your pregnancy, the hormone relaxin has made your ligaments loosen up a little, also responsible for your potential bouts of clumsiness this past trimester. Before you go into labor, you may notice that the joints all over the body feel a bit less tight and more relaxed. It is just nature's way of opening up your pelvis for your little passenger to make his way into the world. An increase in vaginal discharge, possibly brownish or pinkish in color, or it is strained with blood. So this type of discharge is also the sign of labor. Some women feel nausea or vomiting even you don't feel in the third trimester, but if you feel that, it is also the common sign of labor. Softening, thinning, or dilation of cervix, as shown by doctor's internal examination. She will or he will declare that the thinning of cervix occurs. It means that body is getting prepared for labor or the birth. That is, unless you are feeling the opposite of super sleepy, some moms get a burst of energy. So if you feel like that, you may be in labor in a few days. Urge to urinate. If you feel the urge to urinate, or you may feel to go to pee but you cannot, so it is also the sign of labor. It is due to pressure on the pelvic area, so you may feel the urge of urination. Nesting instinct. As the baby's birthday near and can't resist the compelling urge to clean and organize everything inside, that's okay too, as long as you don't undergo it, because it is the female instinctive behavior that she will decorate the room or area for the upcoming baby. So if you feel like that, then you may go in labor in a few days. Lightened. Your baby drops into your pelvis in the weeks, days, or hours before labor. This is called lightening, because you may find breathing easily because the suppressed lungs are now released to get breathed properly. So you may feel lightened at the near of labor or undergoing the labor. Hope you have understand all the 21 signs of labors, and if you really find this video useful, then subscribe our channel and share this video. Thank you.